Hi, we're here today to talk about the Naylor Review. The Naylor Review is a blueprint for selling off NHS land and property, and Theresa May is backing this whole hog.
The manifesto pledges, quote, the most ambitious programme on investment in buildings and technology the NHS has ever seen.
That money will be following. There's a report that was done on the NHS, the Naylor Report, which set out what was needed, and we're backing the proposals in the Naylor Report.
And in her interview with Andrew Neil, the Prime Minister Theresa May referred to it as a paper about the NHS and something that she was happy to implement all the recommendations held within. And essentially, this is another phase of privatisation. This is the land grab.
Well, what preceded it was several stages where the NHS has been prepared for this latest attack. We've seen the network split up into foundation trusts, which are separate business entities. So you've broken up the NHS network. You had private finance initiative, which saddled hospitals with massive debt. And in 2009, you had more legislation, the unsustainable provider regime, which allowed the debts of one hospital to be used to justify the sale of hospitals that we publicly own.
Yeah, and all of this has rendered the NHS very, very vulnerable to corporate takeover, because every single step actually undermines the care that patients receive and the experience that they have. And I think there's some really key things about the Naylor Report that the public needs to know. Now, you mentioned the precursors to this, and one of these was the 2012 Health and Social Care Act, which abolished primary care trusts. The land of these primary care trusts was handed over to a private company, a private limited company called NHS Property Services, NHSPS, which is referred to repeatedly in the Naylor Report. Now, that accounts for about 11% of NHS land assets. The significant thing about the Naylor Report is that they advocate the setting up of an NHS property board, which will essentially oversee 100% of NHS assets. So all of that property is up for grabs.
And it seems the way the report is worded, that the only way that hospitals can fund new capital spend, buying scanners, buying equipment for the hospital, is by selling their land and their assets. And this is being incentivised, isn't it? Indeed.
In supermarket speak, they have talked about a 2-for-1 offer, and essentially that means that when land is bought by the private sector, and they're aiming this at private developers and housing associations, when that land is bought, then the government will essentially give that money again to the trust or to the area, if this is in the context of the STPs. This is a limited time offer and is on a first come first served basis. So this suggests that there's some urgency about this sell-off.
I think they use the words a 2-for-1 offer. For every £1 raised by the sale of land and assets, the Treasury will give a further £2. So you can see senior managers being actually manoeuvred into a corner where they have no option but to sell off hospital land and hospital assets. And we already have the lowest number of beds in Europe to look after our patients. I know my patients struggle to get into hospital. And what the Naylor Review will do is further exacerbate the chronic underfunding, under-resourcing and bed crisis within our NHS.
They will. They talk about the use of land efficiently, and we don't really know what that means. The other thing that they talk about is there's a punitive measure. So if hospitals do not offer their land for sale, then they will not be given any kind of capital investment from the government. So this is really very significant.
There is no choice. They have to adopt what Naylor does, because Theresa May is supporting his review and there's no other game in town. And you mentioned Simon Stevens. He's put forward this 5-year plan, and amongst that plan is something called the Sustainability and Transformation Plan. And this will require some investment to get us to the American insurance-based system. And part of the transformation is to break up the hospital network, to shrink down NHS provision And part of that shrinking down and freeing up, liberating the assets within the land and the property is where the Naylor review dovetails in.
Absolutely. One of the must-dos before transfer over to the sustainability and transformation plans is that areas must be in financial balance, and a lot of areas are struggling to do that. They have proposed downgrading services or even closing some services, particularly A&Es are suffering, but selling off property is another way that they can actually gain financial balance.
Well, what they have done is they've painted a picture within the public's mind that the NHS is a business. And they've also set it up to be painted as a failing business, and these are their solutions to the problem that they have created. So hospitals have had their funding squeezed, the amount of funding they receive for doing an operation has gone down, the demand has gone up, the capacity has gone down, so we have a perfect storm, and the only solution on offer, flog off your land.
Yes, it is the classic in the words of Chomsky, you defund, people get angry, then you hand it over to private capital. And that's exactly what they're doing with the NHS. Indeed, this was part of the plan. Oliver Letwin himself said in 2004 that within 5 years of a Tory government, there would be no NHS. So you can see the reason for the urgency. They're a little behind schedule.
Well, in fact, I think that the narrative used with the forthcoming election, that is to strengthen her negotiating position on Brexit, is a complete fallacy. What they're trying to do is get away with the biggest privatisation, surreptitious privatisation, smashing up of the welfare state, destroying public services with a bigger mandate, because if they have a small majority, they wouldn't be able to get away with it. So, you know, in the forthcoming election, people need to see the lies for what they are. Theresa May is promising us that the NHS is not for sale, yet she's backing the biggest land grabber ever possible. And they declare undying devotion for the NHS. Well, this is not true. We're going to an American insurance system, and you need to make a very careful decision based on the facts that we have revealed to you today.
Yes, I totally agree, Bob. This election was not called because of a Brexit negotiating position. This is the Conservative Party trying to strengthen their position so they can push through their ideological crushing of the National Health Service, all public services and the welfare state.
Well, this story we've told you today is part of a bigger and more complex and longer running deception which we're going to hope to explain in our film The Great NHS Heist. Please support our film, go to our GoFundMe page and follow us on social media. Thank you. I'm Dr. Bob Gill, and throughout the 17 years I've been a general practitioner, I've witnessed our health service, which is free at the point of use and already funded by you through taxation, being stolen. A little at a time, over consecutive governments, our NHS has been manipulated, restructured and carved up to ensure its component parts are ready to hand over for the profit of private corporations. Although we are being told the NHS is not being privatised, that is wordplay. The contracts being awarded to private profit-driven companies effectively means we are handing over our public health budgets to corporations who seek to constantly grow and profit. The care you get will be compromised, and the contracts with these companies are cast iron. There's no going back. I'm appealing for you to support our documentary, The Great NHS Heist, a film seeking to expose the deception and bigger picture of this complex heist. But we can't do it without your help. Please spread the word and support our GoFundMe campaign. Thank you.